warm welcome to all of you in this lecture series of Panchakarma from Ayurveda Network, Faculty of Ayurveda, BHU. Myself, Dr. Rajkala Panchakshari Patil, Associate Professor and Head of the Department of Panchakarma, Faculty of Ayurveda, IMS, BHU. In today's lesson, we will discuss the clinical insights to Udwartana, that is the dry powder massage. Coming to the what is the Udwartana? Udvartanam is stand out as a distinctive Ayurvedic powder massage therapy which differentiates itself from the Abhyanga by its unique application of the direction and the pressure. Udvartana showcases remarkable efficacy in addressing various clinical conditions such as obesity, dyslipidemia and cerebral palsy. It possesses qualities of shoshana, that is absorption, and kapha medohara, that is elevation of vitiated kapha and meda, while also demonstrating favorable impacts on psychophysical parameters. This lecture deals with the detailed procedure of Udvartana, emphasizing its significance and benefits in clinical practice of Panchakarma. In classical importance, it's given by Sushruta, that is Udvartanam Vataharam Kafamedo Vilapanam Sthirikaranam Anganam Tvak Prasadakaram Param. Like, what is the use of Udvartana in clinical practice is demonstrated by Sushruta, like for the Sthirikaranam Anganam to get the and Tvaka Prasadakaram, we are using the Udvartana. And in Ashtanga Hridaya, he says the importance of Udvartana as where to do the Udvartana, or what in Panchakarma where we do the Udvartana is the condition, that is Mamsala Medura Bhurishleshmanaha Vishamagnyashya Sneho Shitashatan Ye Sneha Tan Purvam Rukshayet Tata Sansneha Shodhayed Evam Sneha Vyapanna Jayate. This is the ideal clinical condition for Panchakarma where we use the Udvartana. Whenever there is the predominance of Mamsa or Meda or Kapha, and whenever there is Vishamagni in any condition, whether any disease or any condition, or those who are indicated for the Snehapana or those we are planning for the Panchakarma, in all this condition we use Purva Rukshana. That is the how we do the Rukshana in external therapies. We use the Udvartana in such conditions. So this is the clinical application of Udvartana in Panchakarma. So we use as a pre-operative of Panchakarma, like Rukshana, where we do the Dipana Pachana and Rukshana, there we use the Udvartana. Whenever there is Amavastha, whenever there is Mamsa Pradhanta, whenever there is Meda Pradhanta, whenever there is Kapha Pradhanta, whenever the disease becomes the chronic, there we use the Udvartana in a clinical practice of Panchakarma as a Purva Karma. Sometimes we use Udvartana as a Pradhan Karma also. In these conditions where there is obesity, psychological disorders, muscular dystrophies, we use it as a main Panchakarma or main procedure also. So Udvartanam is a unique Ayurvedic procedure, that is the powder massage, which involves massaging the entire body below the neck with a gentle pressure moving against the direction of the hair growth. That is the most important. In Abhyanga we do the towards the direction of the growth, but here in Udvartanam we use it as a against the direction of the hair growth. Charaka also refers to this procedure as a Sharira Parimarjana, while Chakrapani associate it with a regimen following the Abhyanga. That's why we in a traditional culture of Maharashtrian practice, we use this Udvartanam and Abhyangam during the Deepavali festival to clean the body. Coming to the types of the Udvartana, there are different types explained by the different acharyas. In Charaka's classification, it is based on the therapeutic effect of Udvartana. It classified into two types, that is Snigdha Udvartanam and Ruksha Udvartanam. Snigdha employed for the treating lean individuals. This approach involves using oil during the procedure, while the Ruksha Udvartanam is tailored for the obese patients. This type utilizes dry herb powders without oil. And in Sushruta's classification, he classified the Udvartana or dry powder massage into the three types. First is the Udvartana, second is Udgharshana, and third is the Utsadana. So the Udgharshana he explain the difference between Udgarshana and Utsadana is as in Udgarshana they use the dry powder massage which rubbed on the body, while Utsadana is involves the use of paste of the herbs moistened with the oil during the procedure. That is the Snigdha and Ruksha Udvartana. It is noted in the context of Shashti Upakrama in the Sushruta. Materials required, coming to the procedure detail of the Udvartana, what we required for the Udvartana is the Dhara table or Dhara Pati, we can say as a massage table, herbal powder or oils as prescribed. So, sometimes we use only powder, this is the dry powder and this is the powder mixed with oil. Then 2 therapists to do this and vessels for the oil and the powder. Types of Udvartana as a procedure. We do, as I explained previously also, there are 2 types of Udvartana procedure types. One is the preoperative, when we use it as a before Snehapana or before Panchakarma to get proper Rukshana, that is a preoperative procedure, Udvartana as a preoperative procedure, or sometimes we use as a individual therapeutic procedure where we use to lose the weight in the obesity patient or in the muscular dystrophy patient or in the deeper dhatu, when deeper dhatu is involved in the disease, there we use it as a individual therapeutic procedure. The choice of drug with indications for Udvartana. When we plan Udvartana or Snigdha Udvartana, the indications are lean and thin patients. Choice of oil is based on the Prakriti or constituents or the Satmya or where the patient is belong to, Kasmin Deshe Jataha. That is also very important to choose the oil, because if the patient is born in the Kerala, usually they prefer the coconut oil, or if the patient is born in the north, they usually prefer the mustard oil. So, the choice of oil is also based on the Prakriti or Kasmin Deshe Jataha. If the patient is delicate skin, then we use the oil. Whenever there is a Raktanubandhi disease, that is for example Vata Shonita, we use the oil. Vata Pradhana disease like Vata Vyadhi, Pakshaghata, wherever there is Vata is involved, or infant or baby, for baby massage, we usually never use the dry powder, we add some oil in that whenever there is the muscle wasting. And here are the indications of Ruksha Udvartana. When the patient is obese, there is a muscular disease like muscular dystrophy, myasthenia gravis, MND, hypercholesterolemia, hypothyroidism, Cushing syndrome, Amavastha of the diseases, those patients eligible for Snehapana in the depression and in the psychological conditions, we use the dry powder massage. The indications for Udgarshana is very clear. For the Ruksha Udvartana, Siramukha Viviktatvam, where whenever there is indicated, we do the Udgarshana. And for Utsadana, the indications are beautification. For the beautification purpose, we do the Utsadana to increase the skin luster. The contraindication of Udvartana are, it is not prescribed in any text, as it's a very small description is found about this procedure in the text, but with the practice and with the clinical experience, we have come with this conclusion that Udvartana should not be done in such condition, that hypertension, sometimes the in atherosclerosis, the plaque may dislodge and it may lodge into the brain or heart. There are the chances of getting the heart attack or the stroke. That is why if the patient is hypertensive, Udvartana should not be done, or it is totally contraindicated. If the skin disease is there, so rubbing with the powder or with taila and powder, it may harm the skin. That is why mostly it is contraindicated in the skin diseases. In cancer patient also, as there is the bala is very less, so it is contraindicated. In the Visarpa patient, again the Pitta Rakta Dushti is there, so that may spread. That is why in Visarpa Udvartana is contraindicated. If the skin is so delicate in some patients, so there if you do Udvartana, it may, the rashes may occur. That is why the Udvartanam is contraindicated. In Vata Pradhanta also, to avoid the further Vata vitiation, it is contraindicated. And whenever the disease is due to Kshaya, the Udvartana is contraindicated. Or in short, when the patient is indicated for Bruhana or for the Santarpanjanya, the Udwartana is contraindicated. Coming to the detailed procedure, in Udwartana, it involves the applying the medicated oil and fine herbal powders on the body. It should not be dry or coarse powder. It may uh, start the skin irritation. That's why it should be herbal powder with a fine herbal powder, followed by the massage in the opposite direction of hair growth. The main step include patient's preparation, positioning and performing various types of massages on different body parts. So usually we do in the same 7 position what we follow in the Abhyanga. So duration of Udvartana, each body parts is massaged for the 3 to 5 minutes with the entire procedure typically lasting for 30 to 45 minutes. If the patient is too obese, so it may take more than 45 hours also. If the therapists are only 2 therapists or only 1 therapist also, then again it may get, the duration will be increased. Post procedural activities. After the procedure, ask patient to rest for the 15 minutes and he may take a hot water bath or lukewarm water bath after at least 1 hour. As when we do Udvartana as a main procedure, so mostly we ask patient to take or we prescribe the Sarvanga Bashpasveda after the Udvartana to liquefy the Meda and to get the better result of Udvartana. So in such cases, the post-operative care or activities, we ask patient to take bath after more than 1.5 hours. So care and precautions. Before taking the patient, we ensure that a bladder is empty and bowel. Ask patient to clear the bowel before Udvartana. The massage direction and patient positioning should be adhered to the classical text. Assess indications and choice of the drug before Udvartana. Avoid the tender areas like face or some tender areas in females. Take precautions while dusting powder to prevent the irritation. Maintain aseptic measures for the contagious disease. The clinical applications of different powder massages, this is what the classical references we get from the Sushruta, where to use Udvartana, where to use Udgarshana and where to use Utsadana. For Udvartana, he says Kafa Medo Vilapanam, Vataharam, Thirikaramanganam and Tvak Prasadakaram. These are the indications for Udvartana. For Udgarshana, Udgarshanina Utsadana, matlab he says it is for the Kandu, Kotha and Vata Shamana. Udgarshana is useful. For Utsardana, he says Visheshat Kanti for Strinam Visheshat Kantimat. Praharsham, Saubhagyam, Laghavadi Gunanvitam. These are the ideal action of Utsadana. Coming to the probable mode of action, Utsadana is indicated in Medoroga owing to its Kapha Medo Vilayana Guna. Due to Ushna and Tikshna Guna of Dravya and forceful massage effect on Romakupa, the virya of drug enter into the body through the opening of Sira Mukha, thereby making Paka of Kapha and Meda. The Udvartana also stimulates the Tvakagat Agni, that is the Bhrajak Pitta. As it is mixed with Taila, it acts as a Srotoshodhana which normalizes the path of Vata, which helps to overcome the Avran pathology. So, medicines we use for the Udvartana, mostly Triphala Churna or Triphala powder, Kulakulattadi powder for the babies or for muscular disorders, Yava powder for the routine clinical practice for obese patient or for as a pre-operative for Snehapana. When we use the Vacha Churna or Yava Churna. Aragvadadi Gana powder for the diabetic neuropathy or for the diabetic patient we use the, or whenever there is skin is involved we use the Aragvadadi Gana Churna. Haridradi Gana powder also we use in such condition where there is Kapha and Vata is involved. Kulatha powder for the obesity, Nimba powder whenever there is skin is involved and Trikatu powder for the obesity. So with this I thank you all. Thank you.